Good afternoon, Lisa.
Good afternoon, Sarah.
Today I'm going to talk about the Airvo 2, and I'm trying to use it so that it makes it easier on people, other nursing staff, to make it easy for them by using a cheat sheet and their app that has been created by Fisher & Paykel. So today we have our oxygen tubing that we will use. We have our water bath and also the tubing that we'll use, and the high flow nasal prongs. We have the 2 litre water for irrigation set up there. So I'm going to teach Lisa how to use the machine today. So first of all, we have the red tube, which is what we use for cleaning. So we need to remove that first.
Okay.
So by removing it, there's the blue tube, you lift it up, then it makes it easier to remove it. And we put that into the basket so we don't lose it. We also take away that, so the filter, so that we don't lose that as well. So to set it up, we need to use the water bath to start off with. So here is the prong that we'll use to actually connect it to the water for injection. So we can do that first. We then have the eyes that we need to use. So we need to make sure that the tube sits on this side, and it can be a little bit fiddly, so that goes on that way. And we connect it into a little slot, and then we turn around. Now the idea of this is that this pushes down. It is a little bit fiddly to get it in, so you need to try and focus the eyes on there, and with a little bit of a tilt and pushing down. Okay. Now as Lisa is setting this up, the reason that we use this machine for people are for people that have a history of COPD, people that desaturate. You're having a little bit of difficulty there?
Yes, I am.
Okay, so to actually get it in, can be a little bit difficult. So hang on, I'll just take that out for a moment. I always find it easier if you put your foot on. If we tilt it and push down, there we go. And so you listen for the click. There we go.
Excellent.
All right, so the next piece of tubing, so as I was saying, we also use it for type 2 respiratory failure and thick secretions. So the next piece of tubing that we put on is this tube, which, like the red one, it's also got the blue cap, and you can see that the little 2 little eyes at the top matches in. So you'll have to lift the blue before you actually get it on. Just lift that up, that's it. That's it. And then the next one is connected by the oxygen nasal prongs. So that just goes into there.
Straight in?
Straight in, and then you'll hear the click. And we can just hang it there while we're ready to get it going. Here's our oxygen tubing that we're going to use.
Where do I connect
And
that?
so we connect that to, there's a little blue spot there.
Yes.
And then our oxygen on the back of the wall. We also have the machine plugged in, and our oxygen source comes from the oxygen tubing. This is just a flow machine that provides the warm flow of air. Okay, so now we need to turn it on. Well, Lisa has now set up the Airvo 2, the high flow oxygen. So when we connect these to the patient, we would actually connect them like any other nasal prongs that we would. They fit quite nicely around the back of the head, and they're very soft and rubbery. They're very comfortable, and I have found that the patients actually tolerate this very well. So we'll just hang it for now. So with this machine, there is actually a new app that has been created by Fisher & Paykel, as you can see. It's an app that has been created which we can use when you haven't used the machine for quite a while. So you can turn it on, and it sets it up just the same. So that is the app that you can use, but I'm actually going to teach you how to do it. So you can turn the machine on, just as that's coming on. There you go. Okay, so we have the machine on. We are connected to the oxygen, which you have done. This is connected to the patient. So now that you've got it set, it will automatically set, the temperature will be at 37 degrees, which is what it usually goes to. It is actually at a default setting, so it can be changed if you need to. The litres per minute is what we set. We start off at 50 to 50. So we turn our oxygen on. We normally turn that on to full. Yes, so you can turn that on.
15 litres as far
To
as
15 litres as far as it can go. Great. And to actually adjust our settings, the arrows, the up and down, if you actually hold those down together.
Yes.
So I'm sorry, before we do that, the arrow that single arrow, that can actually move it along. So the temperature it'll take a few minutes to reach the 37 degrees, but we can move across to the litres per minute, which you can just touch that's correct.
Yep.
And then if you hold the two arrows down, you can actually adjust. Now it starts flashing on the right hand side, as you can see. You can now just adjust it up and down to what you want it to.
Okay.
So we set that at 50. Yep, great. And then we can just confirm that we've done that. And we can now do the same for the oxygen level. Great. Yep, and then up and down. Great. Yep. And that's set at 50. So the machine is now ready to use for the patient to be set up. And that's the Airvo 2.
Thank you, Sarah.